morning, Tuesday, October 28, 2025. We are broadcasting live spine surgery from Duke Spine Institute here in Florida. Our patient comes here from Texas. He has had back pain for over 4 years. He does landscaping with his wife. They have a company in Texas, and he's just been smitten with back pain. He's injured his back originally in 1993. He was in a motor vehicle accident, fractured his femur, injured his back, but the pain wasn't bad for many, many years until recently. And that's typically what happens when you get back pain. You injure your spine, and then it takes many years for that arthritis to set in and start causing back pain. We did a telemed over Zoom, just like many people have the opportunity. It's free, and I diagnosed the source of his back pain being 3 discs. So, we're going to go repair those 3 discs. Any questions? Type them up. In the meantime, Henry, since we're on the subject of what causes back pain, why don't we share with our audience the 30 different causes of back pain? Shot? I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Lateral. All right, welcome back. Our patient has 3 discs that are causing his back pain. No, I need to advance L3-S1, Louis. 3 discs causing his back pain. We are in the process of getting into those discs so I can treat them. The way we get into a disc is we use a needle. Excuse me. The needle is steerable and allows me to see where I'm targeting using the X-ray machine to place the needle. And then once I am inside the disc in the right position of the disc, we do what's called a discogram to confirm that the patient's pain is coming from that disc. Shot? All right, so we're going to do a discogram in just a moment and verify that the discs are the cause of his pain. So when I asked him where his back pain was on his Zoom call, he said it's in this area right here. All right, that's his lower back. I looked at his MRI and verified that he has 3 discs that are damaged: L3-S1, L4-5, L3-4. Are you having any pain?
Do you have any back pain right now? No back pain.
All right, come on, Louis. I know what you're waiting for.
Stay still.
How bad is that on a scale of 1 to 10?
8.
What's the highest it goes? 10? What's the highest it goes? 10. Yeah. All right. So is that where you get your back pain?
Is that where you get your pain? Yes.
Good job. We're going to get rid of that for you. Good job on the discogram, Dr. Berndes. All right. Is it better now?
Don't move your hands, please.
How bad is that on a scale of 1 to 10? What's the highest? 10. Is that where you get your back pain? Is that where you get your back pain?
Yes.
Congratulations. We found 2 of the 3 discs that are causing your back pain. Is it better now? All right. You get to go to sleep now. This one is so collapsed. Shot? Any pain there? Can't really get anything out. Yeah, how bad is that on a scale of 1 to 10? Is that where you get your back pain? All right, you get to go to sleep. When you wake up, all that pain's going to be gone, my friend. So great news. We're able to verify with what's called a discogram. A disc is the joint between the bones in your back. That's where his pain's coming from. Gram means picture. Discogram is a picture of the disc. And the discogram demonstrates 3 discs that are damaged with tears. And at Duke Spine Institute, we discovered that it's the tears in the back of the disc that cause the patient's back pain. Specifically, the tears in the back of the disc that cause the patient's back pain. So using laser technology, which is FDA approved, and endoscopic spine surgery, I'm able to go in, repair the painful discs so that they're no longer painful for him. It literally takes 10 minutes a disc, and that takes care of the pain permanently for him for the rest of his life. Tell me when. Any questions? Feel free to type them up and I'll answer them for you during surgery. This is a live stream. We're streaming on YouTube, X, Facebook, LinkedIn, I think. Though LinkedIn didn't like us for a while. Are they liking us now, Henry?
At the moment, there's not much of viewership, but there we do have it on, yes.
All right, very good. Any questions?
Yes, we have a question from Rick on YouTube.
Hi, Rick. Welcome. So while I take Rick's question, if you're watching, I'm using the X-ray machine to guide what's called the dilator, D-I-L-A-T-O-R, which spreads the tissues apart, not damaging anything, but just spreading them. This dilator is now going inside what's called the tear, the annular tear in the back of the disc. I use the dilator to create a passageway for a small tube, and that metal tube is called the tubular retractor. I use that tubular retractor to do the whole surgery. You guys are going to see it in just a moment. Can you guys see the tube right here?
Yes, we can.
This is a 7-millimeter tube. You won't find this surgery anywhere else in the world. Duke Spine is leading the world in curing back pain. And this procedure is called the Duke laser disc repair. We've been doing it for 20 years here at Duke Spine Institute. 20 years. Way ahead of everybody else. We have over 2,700 laser surgeries that have been done here at Duke Spine by me in the last 20 years. So you guys are watching the most advanced spine surgery in the world. Look at the red color. That is inflammation around the tear. That's where his pain is coming from. It's a sign of inflammation. Inflammation is the cause of the pain. All right, we'll take Rick's question from YouTube.
Asking, does the DLDR keep adjacent disc disease at bay, or is adjacent disc disease just a part of having spine surgeries on your disc?
Rick, you asked the question of the day. My man Rick, I believe Rick's a man, but these days you don't know. Rick has asked the question of the day. Does this surgery, laser you're watching right now, called the Duke laser disc repair, does this surgery prevent adjacent segment disease? Because here's the problem, folks. Invasive spine surgery, which is what spine surgeons have been doing for the last 80 years, invasive spine surgery, the problem is that when we as surgeons start getting into your spine and doing things like microdiscectomies, laminectomy, fusion, artificial disc, any type of spine procedure, mostly, you're going to change the biomechanics of the spine during the surgery, because the surgeon is removing normal bone from your spine to get down to the part of the spine where they have to operate. So let's say they're doing a discectomy. They're operating on your disc. Let's say they're doing a laminectomy. They're operating on your lamina. Let's say they're doing a fusion. They're operating on your entire spine, front and back usually. Or an artificial disc. They're operating on the front of your spine. Any of those surgeries, which are 1 million plus a year performed in the United States, the most common surgeries done, all of them change the biomechanics of the spine after surgery. The patient's spine alignment and function has changed dramatically as a result of removing those normal structures like ligament, bone, muscle, and tendon, okay? So those surgeries are invasive. They cause damage and loss of muscle, ligament, bone, and tendon. And as a result of that, the patient's spinal mechanics of movement and posture have changed and forever. And that causes adjacent discs to become painful. They wear out, become painful. That's called adjacent segment disease. And it's not just discs, by the way. It's also facet joints and sacroiliac joint. So adjacent segment disease means that the moving parts above and below the operative levels become diseased and painful or symptomatic. And the question is, does our surgery, this one you're watching right now, also cause adjacent segment disease like all the other surgeries do? The answer is no, it does not. We never see adjacent segment disease. In 2,714 Duke laser disc repair surgeries that I've performed over 20 years, I have never had a single patient with adjacent segment disease. Not one. So this surgery you're watching right now, because it does not take away any movement, because it does not remove normal bone out of your spine, because it does not remove or damage ligaments, tendons, muscles like other surgeries do, it doesn't increase your chances of getting adjacent segment disease. So no, there is no increased adjacent segment disease, and that's based on observing our outcomes, patient outcomes, okay? It's not just based on theory. It's not based on anything but fact. Fact is, our patients don't develop adjacent segment disease that have this particular surgery. Now, every other surgery they will, but not this one. It's one of the advantages of the Duke laser disc repair. Great question, Rick. You get question of the day so far.
At this moment, no current questions.
All right, in that case, let's show the audience. We've already done the 30 causes or not?
Yes, we have.
So they all are aware that there are 30 specific causes of back pain. This patient has 3. He has 3 discs, so 3 causes, and we have to fix all 3. If we don't fix all 3, he will still have pain. We just verified that all 3 cause pain. We did the discogram. The discogram is a test. It's done by sticking a needle in a disc, injecting dye under some pressure to see if that disc is painful for the patient. Normally, a disc is not painful. Even if you have a damaged disc, like a degenerated disc or herniated disc that's not painful, which most herniated discs are not painful, the patient will have 0 pain when you do a discogram from a non-symptomatic disc. So a discogram only causes pain in what's called sensitized damaged discs. So I'm not making this up. This is well established. Unfortunately, you're going to find literature that goes against discograms because the insurance companies realize that the discogram is such a reliable test of disc pain that they don't want surgeons doing discograms to confirm that the disc is painful. Why? Simply because if you prove the disc is painful, then you have to do surgery to fix it. And the insurance companies don't want spine surgery being done for back pain because they know they're going to have to spend more money paying for surgery that people need, and they don't want to do that. They're evil. All right, look over here. You guys see that pink stuff right there? That is inflammation in the annular tear. It's what I've been talking about. Duke Spine Institute was the first in the world to discover this, that is the cause of back pain and neck pain. And I'm actually the one who made the discovery, Dr. Duke Machen. So it's my discovery. I published it. We talk about it every surgery, how inflammation is the cause of back pain and neck pain in patients with symptomatic painful discs that are damaged. All right, any other questions?
At this moment, no current questions.
Let's go ahead and show the audience how discs can become so painful for patients through injury.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that trauma to a disc or joint in your spine can cause an injury to the disc. We call those injuries annular tear, which then leads to herniation of fragments of the nuclear material that's found just within the annular wall. Once those pieces of herniation escape through the annular wall, they get stuck inside the annular wall as they're leaving, They cause the body to react through inflammation. And that's what causes the back pain and neck pain. And thoracic pain, for that matter. Any questions?
At this moment, no current questions.
All right, thanks.
While we're waiting for another question, why don't we show the audience of how it is that we cure discogenic lower back pain?
I love it. Go ahead.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. And there it is, folks, right there. You guys see it? There is proof. Proof right there. That's the inflammatory tissue I've been talking about. And it's red. Now, normally these tissues are white. That is annulus right there. And nucleus, annulus and nucleus are normally white. They only turn pinkish red from inflammation. That is a clear 100% proof that it is inflammation happening within the annular tear. We are in the annular tear right now. This is the annulus, this white stuff. So Duke Spine, myself, was the first in the world to show you this inflammation. We started seeing it 20 years ago. We've been showing live streams like this for the last 12 years. And you guys can go back and watch our live streams on YouTube from 12 years ago and see this inflammation that I'm talking about, okay? Very important. It is called annulitis, inflammation of the annulus, annulitis. There's some more right there. And it is the cause of discogenic back pain. Okay, that was discovered by me 20 years ago. And I've been trying to tell doctors and patients about it. Doctors don't want to listen. They're stubborn. They know everything. Patients, on the other hand, there's hope for you guys because you want to get fixed. Most of you are suffering and you want to know why. So I've given up on trying to teach doctors because they don't listen. They think they know everything already, and I've just focused on teaching patients and anyone else that's interested in learning the truth. That's what we do here at Duke Spine. All right, we're just about finished with the first of 3 discs. And remember, this was a 10 out of 10, right, Luis? So when we tested it, he said, oh, it's a 10. It hurts so bad, it's a 10. And I asked him, is this where you get your pain typically? He said, yes. So we confirmed that his pain is coming from this disc. Before we operated on it, we stuck the needle in and did an evocative discogram. The blue stuff is the herniation, the pink stuff is the inflammation, and the white stuff is the annular tear. Okay, just about finished. There's some more pink stuff right there. You guys see it? That's inflammation. And it's right next to the blue, which is the herniation. So it's the herniation that causes the inflammation. That's what causes the back pain. We talk about this a lot in our videos. All right. Perfect. Just about done. The last bit. Henry,
Yes, sir.
so we're putting out a job to hire somebody to help us with converting these videos into written blogs. Do you have anybody in mind that needs a job that could also back you up?
At this moment, I can't think of anybody, but if somebody
Alright.
good comes up, I'll let you know.
I was going to say you should ask one of your friends, but I don't know if you have anybody interested.
If so, they live in Orlando. And
It's something that can be done from Orlando.
I can ask around, see what they say.
All right, thanks. Let me know. All right. Any questions from our audience?
At this moment, no current questions.
I got 10 seconds left on this disc. You guys can see all that scar tissue, calcium, and the blue herniation. Beautiful. All done. Now, take a look at that tear. Okay, the tube itself is 5 millimeters internal diameter, and that tear that's left is about 3 millimeters, okay? So the body will heal that. Now that I got rid of the herniation out of it, that thing's going to heal quick. That's what has to heal before he can go back to doing normal 100% lifting. This guy's built like a mountain. He's huge, very big and strong guy. And he works with landscaping. He's from Texas, came all the way out here for this surgery because he realized, like Lanu mentioned last surgery, you know, what's important in life is health. What's more important than your health? Nothing. So he decided to spend his money and get the laser surgery done because he didn't want to have a bad surgery like a fusion or laminectomy or artificial disc put in where he could end up, you know, worse off afterwards than he was before. Now, you guys see all the herniation here?
Yes, we do.
We took out about 3 times as much as that, but I just saved a few pieces so you could see what they look like. All right? You guys saw that?
Yes, we did.
Okay, good. So we're done with this disc. We're going to move on to the next, which will probably be L4-5. We've just finished 3-4. Now we go to 4-5. If you have questions, feel free to ask. We'll be done in about 20 minutes, and our patient will then go to recovery for 30 minutes, and then his lovely wife will take him back to his hotel. They'll spend the night in their hotel and then go home back to Texas tomorrow afternoon.
We have a question
Yep,
coming from Mark on YouTube.
good job.
Ask-
Luis.
Asking, can very medical / central thoracic herniations be fixed?
Yeah. So, Mark, I think Mark's asking, can very medial,
Medial.
which
Excuse
is towards
me,
the
medial.
midline, thoracic herniations be fixed? The answer is yes, 100%. We do them all the time here at Duke Spine. You're not going to find it done anywhere else. If you want to fix a thoracic disc herniation, most doctors don't do that because it's such an invasive and dangerous surgery that it takes a highly skilled, highly trained neurosurgeon to do, which I'm capable of doing. But open thoracic disc surgery has a very high chance of complications for the patient, and it's usually avoided at all costs. On the other hand, if we use the laser, we can do it safely. We can do it outpatient. There's no metal, there's no bone or ligaments or tendons removed. Your body is left normal, intact. All we do is come from the side. Now, if it's central, we probably have to go on both sides, left and right. So we have to attack it from both sides. We will never get 100% of the herniation. Nobody in the world can get 100% of the herniation. It's not possible. But we're going to get probably 50%, and that's more than enough to get rid of your symptoms. Oh, look at all that inflammation again. You guys see that? Pink and blue? It's like we're having babies here. Little boys and little girls, you know, decorating their rooms with pink and blue. Some of you may be wondering, what's Dr. Duke Majan talking about? Pink and blue. If you're thinking about kids, little boys like blue, baby blue. That's why it's called baby blue. And that's the color we're seeing here, right, Jordan? Baby blue. And then we're seeing pink. Pink and blue. All right, we're taking some of that out with the grabber because the grabber is a little more efficient sometimes than the laser. They're removing abnormal tissue that has to be removed. Now we're going to bring the laser fiber in and use laser energy to vaporize and remove the rest of this herniation stuck within the annular tear. But while we're doing this, if you have questions, feel free to ask me.
We have a comment reply from Mark once more on YouTube saying, I asked because I have 3 medial to central herniations at T9, 10, and 11.
Yes, Mark, we can help you. What you should consider, anybody out there that has thoracic or neck or back pain, lower back pain, get on our website, dukespine.com. Henry will post a link right now in the dialog box. You get a free MRI review. All you have to do is fill out our form, which is just so we can know what's wrong. You're going to put, I have thoracic pain, and does it go into your ribs on the right side, left side, any symptoms in your arms and legs. And then you're going to upload your MRI images so we can see the MRI itself, as well as the report. So we need your images, we need your report. With those things, the images, the report, and your information about your history, we're going to set up a Zoom call. And on that Zoom call, you can do it from the comfort of your home, your car, your work, wherever you're happy and comfortable to meet with me for 10 minutes. And I'm going to have you lift your shirt up, and I'm going to look at your thoracic. You're going to point to where your symptoms are. And we're going to tell you exactly what's wrong. So it's a diagnosis, what's causing your symptoms, as well as how we can fix it for you. I'm 99% sure we can fix your problem with our laser surgery. We've done it before many times. Our success rate with thoracic Duke laser disc repair is 99% elimination of thoracic pain. That's 1 year. We published the study 1 year after surgery. We asked our patients, we had about 20 patients that we followed and checked on how much of your pain did we get rid of with our Duke laser disc repair. And those 20 patients had an average of 99% as their answer. So there were a lot of 100% and just maybe 95%, I think. And the average was 99%. So that was 1 year on average after surgery. Good study, good data, works very well. And avoid any major type of surgery. So just fill out the form, do our Zoom call. It's free. We don't charge you any money. You don't pay anything. And yeah, that's it. Henry.
Yes, sir.
There's so many other treatments that doctors recommend for their patients out there that don't work. Why don't we show patients a comparison, or the viewers a comparison between those treatments that we know don't work compared to Duke laser disc repair that does work. Hi, I'm Dr. Duke Machen. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain, and that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. We were just chatting about James Bond, and it's sad that my own children don't really even appreciate James Bond movies. But my generation, we grew up on James Bond in the 80s, 60s, 70s, 80s. For those of you who are in your 40s and 50s and 60s, you probably remember the James Bond movies and how influential and important they were culturally to all of us. From a sense of, at that time, there was only journals, magazines like National Geographic, right? Where you can learn about the world. But James Bond was really the first movie series where they traveled all around the world, and you can see all kinds of interesting places in the movie. Whether it's the Caribbean, whether it's Asia, England, wherever. They took the movie set all around the world and filmed the James Bond movies in lots of different countries. So you could actually see a rickshaw in the streets of Thailand. I mean, most Americans never even knew what a rickshaw was, but once you saw it in the movie, you're like, oh wow, that's from Thailand. That's pretty cool. So you could see architecture, you could see cultural differences in the movie. The movies were very important back in the 80s, for 60s, 70s, 80s, for teaching people about, different cultures around the world, especially James Bond. And technologies that were available. So you would actually watch a movie to learn about other cultures and other technologies that are available. Nowadays, nobody thinks about movies as being a source of valuable information about our world, but back in the 60s, 70s, and 80s, movies were very educational for people that watched them, because we didn't have our cell phones and we didn't have internet at the time. We just had movies. So you learn from your textbook, you learn from magazines, and you learn from movies, and eventually television as well, radio, but very different media than we have today for learning. And I think much better back then too. All right, we are going to fix the last disc, L3-S1. So we'll be done in about 10 minutes. Are there any questions?
Yes, we have a question from Pawn Lust on YouTube asking if transdiscal surgeries are for cervical, does the dilator have to go through the nucleus?
Yes. Yes, you're correct. So, Pawn Lust, the best surgery in the world available for cervical spine is the Duke laser disc repair, cervical. Okay? And to get your herniation out and clean the tear in the back of the disc, you must go through the disc. So it's transdiscal. And of course, take it out. It looks like it's getting pinched pretty hard. Yeah, shot. He's very difficult to get to 5-1. Let's see. Let's hope we're in. Go. So lumbar is not transdiscal. It's transforaminal. Thoracic is transforaminal. Cervical is the only one that's transdiscal. All right, let's see where we are. It just looks terrible on the x-ray, but we know because we did a discogram. Yeah. So we must be in the disc. L3-S1, this disc is the hardest to get to transforaminally. There is no easy way to do it. And in some patients, we can't even get to it. This is also the most sensitive for the patient. Yeah. And there it is. Let's get the laser. This will be quick, 5 minutes. Any other questions?
At this moment, no current questions.
And we're just about done with this patient. So if you have any additional questions, please ask. L3-S1 is tough because you're always being, you can't go exactly where you want to as a surgeon. you want to be in that tear, which is right here where we are. But the anatomy frequently forces us to go further either up or down than we want to be. And so we're never in perfect position. And that's the problem. And you're always angled down to the disc. So we got about a few more minutes, maybe 3 minutes left, and then we're going to be done with our patient, moving on to our last case of the day. Any other questions?
At this moment, no current questions.
All right. Well, I've got about 10 seconds, and then we'll be done. So thanks for joining us. We'll be back for one more surgery. What is our last surgery? Thanks for joining us. You did very well. Henry, why is there no light here? Come on, guys. Pay attention. I'm here with one of my post-op patients. We get a lot of requests for Dr. Duke. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Duke laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3, 4, 4, 5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy. It
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient. There was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.